Good afternoon. And thank you so much, Megan, for planning this session and for inviting me to speak. I'm very excited to share lots of information with all of you. Megan, I'll just confirm with you quickly. You can see my slides okay?
Yes.
All right. So thank you all so much for being willing to learn about helping kids with celiac disease. I am so grateful that you're here and that you're willing to learn and willing to do what you can to make sure that kids with celiac disease have access to food that is safe for them at school. So just to give a really, really brief background on celiac disease so everyone is on the same page, celiac disease, it's a chronic autoimmune disease that's triggered by eating gluten, which is a protein that's found in wheat, rye, and barley. There are over 300 documented symptoms that affect any system of the body. Some patients we also know could have no symptoms at all. Eating gluten for a person with celiac disease stimulates the immune system and it causes damage to the small intestine. Inflammation and malnutrition from this damage can lead to severe limitations of bodily functions and long-term complications. The only treatment for celiac disease is the gluten-free diet. As I mentioned before, gluten is a protein that's found in all forms of wheat, rye, and barley. It's most commonly found in food, but it is also used in medications, vitamins, cosmetics, shampoos, and conditioners, and lots of different school supplies, which I will talk much more about in just a minute. So what does celiac disease at school look like? We know that celiac affects about 1% of children in the United States, most of whom attend federal and state-sponsored learning programs every single day of the week. We also know that celiac can cause significant effects on children and their families, as well as the schools that they attend. So where do kids get exposed to gluten at school? So let's start off in the classroom. In early childhood, we see a lot of gluten in sensory tables, in grains and pasta, in art classes and crafts, pasta necklaces, grain collages, Play-Doh. The brand Play-Doh is made using wheat flour. Paper mache is used all throughout childhood art projects, and social studies classes is also made using wheat flour. A science project that uses food. What's been very popular this year is the moldy bread experiment. I can't tell you how many families have called us to say, my child's school is doing this moldy bread project and we need help. So for those of you who haven't heard of the moldy bread experiment, it's when students take slices of gluten-containing bread and they rub it all over the classroom and the school. So they rub it on chairs, on desks, on keyboards, on door handles, toilet seats, and then they look to see which has the most bacteria on it and grows mold the fastest. For a child with celiac disease, having gluten-containing bread rubbed all around their learning space and areas where they are is extremely anxiety-provoking. And so it's one that we have dealt with many times this year. And there are lots of ways to do this in a naturally gluten-free way. One, you could use gluten-free bread, a very easy substitute, but there are also lots of other gels and scrapers and things that you can use to look at bacteria on different surfaces without exposing a child with celiac disease to gluten. What makes things stretch? Everyone has been to a pizza parlor and you've seen them stretching the dough to make the pizza pie nice and big. What makes it stretch is the gluten. And so they do these types of projects in science all the time. And again, a very big risk for exposure for a child with celiac disease. So other types of activities in the classroom, cooking with kids, home economics projects, family and consumer science classes. Gluten, as I mentioned, is found in so many different ingredients, but in these classes, we find it in wheat flour, breads, pasta. Kids come into contact with it with cross-contamination using dirty workspaces or utensils that have previously been used for gluten-containing ingredients. And then there are special celebrations that happen at school, things like a Halloween carnival or a Valentine's Day celebration, prom or a homecoming dance. Food is involved in so many different types of activities, and we want to make sure that for kids with celiac disease, there's a safe way for them to participate. And then, of course, what most of you care the most about is the cafeteria. So we know that some children and teenagers do not always follow a strict gluten-free diet like their doctors and dietitians tell them to do. And we know that they most often stray from the gluten-free diet when they're with their friends. So lunchtime is a big source of concern for kids being exposed to gluten. So where can this happen in your cafeteria? It can happen on hot and cold buffet bars, in foods that are on these places like gravy, marinades, and salad dressings. Shared utensils from the food going between the different dishes, or people not keeping the utensils in the assigned to tray. Gluten-free food falling into gluten-containing foods, and vice versa as well. On the tables, students that are eating gluten-containing foods and then leaving crumbs behind and it getting into the lunches of a child with celiac disease's gluten-free food. And then behind the scenes in the kitchen space where items, when they're prepared in a shared space and there's cross contact. So if you prepare a gluten containing pizza and then don't clean the space well, there's a lot of opportunity for cross contact onto the gluten-free pizza if you don't clean well first. This can happen on, you name it, the type of gluten containing food transferred to the gluten-free food. So there has to be a lot of care that goes into preparing the meal for the child with celiac disease. And then of course, gluten in the food itself that you're preparing and serving to the child with celiac disease. There are also a lot of social and emotional considerations for these kids. So students with celiac disease oftentimes attract negative attention from other kids, but because they're eating different foods, they're asking a lot of questions, or they're having symptoms at school. I can't tell you how many times we hear from patient families, the kids say that their food looks gross just because it looks a little bit different. It doesn't look the same as their friends, and so their friends tease them about it. Oftentimes in the cafeteria, if the students don't feel completely safe, they'll be asking a lot of questions, and their friends will question why they have so many questions, and it makes them feel bad. Other times, if they've been exposed to gluten at school or still having a reaction from perhaps an exposure the day before, and they're having symptoms, they can get made fun of. There is a joke for diarrhea every second, and it can be extremely embarrassing for a child who is having symptoms at school. On the flip side, as I mentioned earlier, some kids with celiac disease have no symptoms at all, and we say that they're asymptomatic. When they're asymptomatic and they don't have symptoms, they can be judged just as much as if they did have symptoms, because people doubt the validity of their diagnosis and oftentimes don't take it seriously. These kids experience teasing, tauntment, harassing, and bullying by their peers, their teachers, their coaches, and other adults. And what we've really seen is that the bulk of the teasing really happens from other adults, not necessarily the kids that they are around, but by the parents of other kids, by teachers, by a food service professional who doesn't want to have to provide the gluten-free food. And so the fact that you're here today learning is really, really important. And it says a lot about the type of individual you are, that you're willing to work with these kids to help them have a really wonderful experience at school. So what does this teasing and bullying look like with a child with celiac disease? These are real life examples that we have worked with families on. The teacher doesn't allow the child to use the bathroom multiple times in a row, which results in the child having diarrhea in his or her pants in the middle of the classroom. This happens a lot. You would be very surprised with the number of accidents that we hear about because the teacher didn't allow the child to go to the bathroom when they really needed to. A pure crumbling gluten-containing bread over a child's gluten-free meal, they think it's funny. They crumble their bread to contaminate the whole meal, and then the child with celiac disease can't eat it or eats it and risks getting sick. The teacher would usually give a gluten-containing treat, but now says, I can't give you a treat anymore because Brandon has celiac disease and I'm not allowed to. So this in itself is a form of bullying. The teacher is saying that is withholding something because of a disability that the student has. In the cafeteria staff grumbles and complains in front of the child because they have to provide a gluten-free option. A child being told that there's no food to eat in the cafeteria while other students are being given lots of choices. A teacher sends a child out of the classroom for a study hall in the library because they don't want to find a gluten-free substitute for paper mache. So there are obviously two sides to every story, but this is one that we hear a lot, that a teacher asks a child to go to the library to read about a certain topic because there isn't a gluten-free option for the hands-on learning activity that the rest of the class is doing. This is something that I don't want to hear about because, well, everybody can agree that reading is a wonderful thing and that all kids should be reading. I read with my son every single night. But what we don't want to see happen to a child with celiac disease is them not having the same access to the hands-on interactive learning that their peers are having because they have celiac disease. So we want to find a way for them to participate and to be involved in the same learning that their peers are having. Getting cut from the travel lacrosse team because the coach doesn't feel like finding restaurants on the road that have safe gluten-free options. Insert any sports team that you want into that statement, and it has happened to a child with celiac disease that we've worked with. Being told that celiac disease is fake because they don't have obvious symptoms when they eat gluten. So that goes back to the asymptomatic kids feeling as though it's not taken as seriously because they're not having visible symptoms. The good news is that we believe that we can prevent all of these things from occurring by setting up appropriate accommodations and working in partnership with the school to make sure that things are set up for the child with celiac disease. So let's talk about laws that govern celiac disease. There are laws that govern disabilities and there are laws that govern food that I'm going to talk about. To start is the Americans with Disabilities Act of 1990. This law defines a disability as a physical or mental impairment that substantially limits one or more major life activities. As we all can agree with, eating, digestion are both major bodily functions that we need in order to survive. And so celiac disease qualifies as a disability. Section 504 of the Rehabilitation Act of 1973, it prohibits discrimination in all institutions that receive federal financial assistance, including schools based on a disability. And as I'm sure you all know, it requires institutions to provide programming that meets the needs of the student with a disability as adequately as the needs of non-disabled students. So reasonable accommodations for children with celiac disease without dramatically altering the structure of your school or institution. So then there are laws that govern food. The National School Lunch Act, which provides qualified students with free or reduced cost meals. And as you know, a gluten-free option is included in a qualified student's right under the National School Lunch Act. The Child Nutrition Act strengthened the National School Lunch Act, and it began to offer financial assistance for schools to buy equipment and to extend the services that they offered for breakfast and lunch for kids. It also allowed the USDA to set uniform standards for nutrition for breakfast and lunch at schools. And what is really important is that it requires that gluten-free meals meet these same nutritional standards as meals served to other students. The last law that I'm going to talk about is the gluten-free food labeling law, which regulates the term gluten-free on food labels. So at a minimum, any packaged foods that are served to a child with celiac disease should meet that criteria as well. So a 504 plan for celiac disease, we get a lot of questions about what type of plan a child with celiac disease should have. And the right type of plan for a child with celiac disease is the 504 plan, with a small asterisk, unless they have another identified learning disability that would qualify them for an individualized education plan. But unless they do have another disability that would require an IEP, the 504 plan is the type of plan we want to see for a child with celiac disease in a public school. Why? So the 504 plan includes all of the necessary accommodations that a child with celiac disease would need. And we pulled this language directly from the National Association of School Nurses to really help distinguish why this plan is right. So to quote their guide, the purpose of developing a 504 plan for a student with a disability is to provide the accommodations necessary for the student to attend, participate in, and be successful at school. A 504 plan speaks to the accommodations needed by the student. It is helpful to think of it as leveling the playing field for the student. So we want to, in one plan, put all of the things that these children need to be able to successfully participate in all of the learning activities and eating activities that their peers are at school. So how do we take all of this and apply it in a standardized way to schools for kids with celiac disease? So actually, a couple of years ago today, we adopted the new recommendations. There was a group of 46 experts that convened to develop them. We held 2 in-person meetings in Washington, D.C. in March and July 2019, and we solicited a lot of input through online forums. To reach consensus, we had participants vote on each of the recommendations, and we agreed to adopt all of those that achieved a greater than 85% approval among the group. And the recommendations that are actually ended up being adopted all had more than 95% approval. So we were really proud that the document we ended up putting out really had consensus among this group of experts. So who participated in this? We had 10 pediatric hospitals. We had professionals from 14 education associations, patient and physician advocacy groups, teachers and administrators from both public and private schools, parents of children with celiac disease, students with celiac disease, a lawyer with expertise in education law, and Schär, who is sponsoring this program today, also participated. The results of these meetings were the 2020 voluntary recommendations for managing celiac disease in learning environments. This document was developed to be applicable in a wide range of schools. So public schools, private schools, charter schools, daycare centers, and in-home daycares, and institutions that do and do not receive federal funding. We aligned the recommendations with the same level of formatting and detail that you see in other guides for chronic diseases like diabetes, food allergy, and asthma, because we wanted them to look familiar. We also developed them so that they would be applicable to any 504 plan for a child with celiac disease. However, if your child or if you work in a school that does not use the standard 504 plan approach because you're a private school or other type of institution, the recommendations are equally as applicable. So what's inside? There are step-by-step instructions for developing a 504 plan for a child with celiac disease. There are approved accommodations for learning spaces, eating spaces, and offsite activities that are sponsored by the school. There's a resource guide to help with understanding the gluten-free diet and an action list for implementing the various types of accommodations depending on what your role is in managing the child. There are also so many resource lists. There's a school supply list, recipes for making Play-Doh and paper mache, gluten-free and gluten-containing ingredient lists, and classroom substitutions for different types of materials that can be used safely for a child with celiac disease. There's even a cooking class and home economics page within the resource guide that has ingredient suggestions, different brands that have easy substitutes to use, safety measures to consider, and then all of the research that has gone into creating these recommendations. So what do reasonable accommodations for a child with celiac disease look like from a food provider perspective? So we would want you to offer reasonably equivalent gluten-free food options that are cooked using methods to prevent cross-contact with gluten. We would want gluten-free food options that meet the FDA's definition for gluten-free food labeling. We would want you to review the labels of food items every time you purchase them. As you know, ingredients can change, and we want to make sure that every time you purchase a food product that it's indeed gluten-free for those children. We want to see a designated gluten-free safe food preparation area with either dedicated or appropriately sanitized kitchen tools. So you don't have to have a completely separate set if you don't want to, but if you're not going to have a gluten-free set of prep bowls and utensils and things like that, we want to make sure that they're properly sanitized so there's no risk for cross-contact. We want you to provide copies of meal menus that include the gluten-free options at the same intervals as meal menus are provided to other students. We want to see clean eating surfaces where the child with celiac disease might eat. One of the most common questions we get is, does a child with celiac disease have to sit at the allergen table? We do not believe so. We think that as long as a child with celiac disease is eating in a clean space and that they know to eat only their own gluten-free food, that there is no reason that they need to sit at a special table. So a few more reasonable accommodations. We believe that all children and staff should be washing their hands with soap and water before and after eating. That if the parents ask, that you should share the recipes and food labels and ingredients list of foods that you are serving to the child with celiac disease. You should develop a standardized procedure for identifying kids with celiac disease who need the gluten-free meals. If there is a suspected gluten exposure, that we want to make sure you're reporting this to the appropriate staff person and to the parents and guardians of the child with celiac disease. We want you to designate a staff member to oversee the upkeep of gluten-free food preparation, ordering, and serving, as well as having a backup person in case this individual who has been identified is absent. This is really important, not only for consistency in your own kitchen or cafeteria, but for the child with celiac disease. We want them to see this designated person as their safe person to go to. If they have a question, if they're feeling unsafe, if they're worried about the food that's being given to them, we want them to have a relationship with someone on your team so that they know that that is the person to go to that they can trust. Finally, if your state requires that the school maintain an emergency supply of food, we want you to have gluten-free food for the children with celiac disease. This is something that comes up fairly regularly. This specific accommodation is listed on lots of different organizational websites and nonprofits and advocacy groups. And the pushback is that a lot of states don't require schools to maintain an emergency supply of food for all of the students. So why should they have a gluten-free supply? And the appropriate answer in this situation is that if your state requires you to have an emergency supply of food for all students, there should be a gluten-free supply as well. But if you're not required to keep an emergency supply of food, then there's no reason to keep a gluten-free supply just for kids with celiac disease. So this is a picture of Mary Vargas. She is the lawyer that worked with us on this project. And I want to just share a quote from her. If your child attends a public school or one that receives federal funding, the institution must provide a reasonable gluten-free option that meets the same nutritional standards as offered to other children. The meal must be of equal caloric and nutritional value, or a hot meal for a hot meal. So this is extremely important every day, but it's even more important right now as the rates of food insecurity have continued to skyrocket during the pandemic. We know that since the pandemic started, that food insecurity has dramatically increased to more than 27.5% of households with children. For many of these households, school is a main source of food where kids receive 2 or more meals a day, and in some cases, weekend meals. And these laws require that schools continue offering gluten-free foods to students with celiac disease. We know that from our experience and hearing from our patient families that a lot of schools stopped offering gluten-free meals when the pandemic started. It has gotten better. We're very grateful that it has gotten better and that gluten-free food has come back in many situations, but in a lot of districts, they went down to just having one food option given to all students, and it most often did not include a gluten-free version. We also hear a lot of schools give kids just whatever they have that's gluten-free, not just in a pandemic, but during a normal school time. So we'll hear that the school can only provide apples, bananas, and yogurt as the food for the children, when their peers are getting protein and starches and vegetables. And these kids are given for breakfast and lunch, apple, banana, and yogurt. We have also heard from schools that say that the only thing they're able to offer a child with celiac disease are corn chips and cheese sauce. So nachos 5 days a week for lunch. We also know that that is not a nutritionally sound way to feed a child. So we really want you to think about this and how we can maintain balanced, nutritious meals for all students, including those that have celiac disease. So what are responsibilities for food service providers? So according to the USDA, that food service staff must make food substitutions or modifications for students with disabilities. As I explained earlier, celiac is a disability. And so kids with celiac disease need to have a gluten-free meal. The substitutions and modifications for these meals have to be documented by a physician. So before you provide a gluten-free meal, you should have a diagnosis letter that is sent from the child's physician that covers all of their dietary needs. So when we have a child at Boston Children's that's diagnosed, they're given a diagnosis letter from the physician that explains they were diagnosed with celiac disease and that they need a gluten-free diet. And then we would expect that those accommodations would be documented within a 504 plan. We would also expect that the school food service offers the gluten-free meals at no additional charge to the children because they have celiac disease. This is also outlined by the USDA. So we don't want to see higher prices charged for the gluten-free food. And obviously the same would apply under the free and reduced breakfast and lunch programs. And we're going to talk more about how we pay for gluten-free food in just a minute. So what are some practical ways to accommodate the gluten-free diet? Serve naturally gluten-free meals whenever possible. There are so many naturally gluten-free foods. We'll talk about lots of them in a moment, but this is the easiest way to do it. Serve fresh fruits and vegetables when possible. Vegetables, fruits, lean proteins, potatoes, corn, and rice are all very cost-effective, naturally gluten-free food items. Use gluten-free bread for sandwiches, gluten-free buns for hamburgers, hot dogs, and grilled chicken sandwiches. You can use cornstarch to bread all of your fried food, and it actually comes out crispier. We moved to Massachusetts this year when I moved to Boston Children's, and the coolest thing about living in Massachusetts is that there's so much fried seafood. And what we've been so pleasantly surprised to find out that there are so many venues that just use cornstarch for everybody. It's just the way that they do it. And so if you haven't tried breading with cornstarch, I would encourage you to try it out because I think you'll actually really like the results. Fry French fries, tater tots, and hash browns in a dedicated fryer so there isn't a risk of cross-contamination. If you have a Taco Tuesday, use corn tortillas instead of flour tortillas so that they're safe for everybody. Select a pizza vendor for your Pizza Fridays that have a gluten-free option. Use gluten-free soy sauce for your sauces and marinades. Offer veggie chips, potato chips, or corn chips that are naturally gluten-free. Use squeeze bottles for your condiments. And choose a food service supplier that has lots of different gluten-free options. There are so many options today for getting gluten-free products. Schär is just one who is sponsoring this event today, but select a supplier who has these options. It makes everybody's life so much easier and will make the families truly appreciate you so much. So I'm going to share a sample gluten-free menu. This comes from Needham Public Schools. I have a 7-year-old son who has celiac disease. And when we registered for Needham Public Schools and set up his 504 plan for celiac disease, we were immediately connected with the dietitian from the food service team who sent us a gluten-free menu. And I was just blown away by how thoughtful they were about making gluten-free food options available to these kids. So they first of all, they have a listserv for families where they send us the menus and information, new ordering techniques. They've actually updated the ordering site so that there's a gluten-free section for us to click into so that it goes to a separate place and the order stays separate so that there is no confusion. It comes out at the exact same time as everyone else's gets the menu for the week. So we're on the same schedule. There's not having to remember additional times for ordering. It's all part of the same platform, which makes our lives really easy. So every day we have the choice of wild butter and jelly on gluten-free bread, a grilled chicken Caesar salad, a hamburger, a grilled chicken sandwich, chicken tenders. There's pizzas available on Wednesdays and Fridays. These are some of the other options: hamburgers, hot dog, nachos, chili, meatballs, plain chicken wings. They do have a breakfast day, and I'm really excited. We just heard that next year they've been able to secure a gluten-free pancake option as well. And then they have snacks and desserts, popcorns, pretzels, and puddings. And every single day, the meals always come with vegetables, fruit, and milk, which is really, really nice that my son is always getting. He gets the same vegetables as his friends. He gets the same fruit as his friends and the same choice of milk as his friends. So how do we pay for this gluten-free food? So in many cases, there really should not be a substantial increase in the cost for the gluten-free food products. In some cases with specialty products, they can cost more, but in my conversations with many food service providers, most of them can find a way to make these products fit into the allocated budgets. We're also actively working on lots of different advocacy efforts to increase reimbursement for gluten-free specialty foods that would be provided to schools under free and reduced breakfast and lunch programs. So we're hoping to help with this in the coming months and years. The USDA suggests that most school food authorities should be able to absorb any additional costs of making meal modifications or by having the services of a dietitian on the team. I can't stress to you how important it is to have a dietitian as part of the food service team. It's something that goes so far in helping the parents feel more confident and just really making it a more seamless experience. Other funding sources that the USDA suggests are the school's general fund, Medicaid if the school qualifies, the maternal and child health services block grants, and parent-teacher associations. So this is just a short little video on how some schools are accommodating a gluten-free diet.
I go to public school in Virginia, and all my friends get a nice, warm, and safe lunch. But I'm stuck with a lunchbox. But now they can provide me a nice and safe lunch.
When Rowan was first diagnosed with celiac disease, the cafeteria at her school did not provide any gluten-free options. Working within the 504 process, we were able to work with the dietitian and the cafeteria staff to identify items that Rowan could have that were safe. And she's now able to eat gluten-free pizza on Pizza Friday with all of her classmates. I'm really excited that she has the opportunity to be included and to have the same thing as her friends.
One way that my school accommodates my gluten-free diet that makes me feel safe and included is at class parties. During class parties, everyone eats gluten-free food so that no one feels left out or different, and I don't have to worry about cross-contamination. I love my school. My school has a no food policy, so I don't need to worry about gluten in my classroom. When my friends bring in a snack for their birthday, I usually get something different because it's usually not gluten-free. So when I get something different, it's usually twice the size. What I love about my Taco Tuesday is that I get to have my favorite food, tacos. And they did it a different way at first, but then I got used to it and I tried it and it was yummy and delicious.
The dietitians at Rowan's school have been working really hard to identify additional options for her in the cafeteria. They're just like her classmates who are also eating Taco Tuesday. It turns out a lot of the options that the kids are getting can be made naturally gluten-free without a lot of accommodations. And so she's able to participate and have some of the very same meals that the other kids are having. We've just had a great experience using the 504 process to ensure that the dietitian and the school cafeteria staff, everybody's on board to ensure that she is able to eat safely.
So the other part of the handbook, and I see in the chat some people are asking about the handbook. I'm going to put a link to download a copy of it into the chat, and then I'll also make sure Megan has a copy of the PDF to email out with the video recording for today. There are action lists for different professionals within the school, health professionals, physicians, parents, children, you name it. If you work in the school or associated with the school or with the caring for a child with celiac disease, we have an action list for you. So I'm going to briefly go over the nutrition services in the school and some of the items that are on that action list. So the first thing that's really important is to thoroughly read the diagnosis letter that comes from the physician to make sure that you understand all of the needs of the child. So celiac disease obviously requires a gluten-free diet, but there are many kids with celiac disease that have other food restrictions as well. So it's very common to see a child with celiac disease who also requires dairy-free food. It's also really common to see a child with celiac disease who also has type 1 diabetes. And so it's really important to read that letter so that you understand all of the needs for food for that child. To carefully read food labels. This is so important for any child, whether it's celiac disease or a food allergy, to make sure that the food that you're providing is safe for them. Purchase gluten-free food options that are safe for a child with celiac disease. That's a no-brainer. But we really want you to look at your ordering lists and make sure that you're selecting options that are gluten-free and safe for that child. Implement a system that allows for preparing food without cross contact. So it's great to buy gluten-free food, but you still have to prepare it safely for the child with celiac disease. And so we want you to think through how you're going to get that food from the package to the plate for the child safely. Prepare breakfast and lunch menus at least a week in advance and provide them to parents. Parents who have a child with celiac disease are extremely nervous about their child being exposed to gluten at school. So anything that you can do to let them know that you've got this, just by being here, I know you've got this. I know you can do it, and I know you can provide safe gluten-free meals. So why not showcase that to the parents of these kids? Send them the menus, tell them how you're accommodating so that they can feel really safe and confident about their child eating at school. Communicate regularly with the school health team regarding any concerns about the student's progress or adherence to the gluten-free diet. It was actually extremely helpful. A couple of weeks ago, we had a family whose child was recently diagnosed with celiac disease, and one of the cafeteria staff actually reached out to the school nurse, who then reached out to us for support, because they saw the child eating food that was not gluten-free multiple times during the week. And so it was really helpful for them to report this so that we were able to then help the child to understand why they were unhappy with the food that they were getting and why they were choosing to eat gluten, even though they knew that they shouldn't. So it's really helpful. You guys are in the cafeteria, you see the kids, what they're taking and what they're eating. And so anytime you have concerns or you see these things happening, it's really important to communicate these things back to the families and to the school nurse. We want to promote a positive psychosocial environment within eating spaces. We want to look for things that are happening, like bullying. If we see kids, making fun of others, mocking the type of food that they're eating. If you hear someone say, "Ew, that's gluten-free, gross," we want to intervene in these situations and help the child with celiac disease. And we want to communicate with administrators to communicate the policies about gluten-free food service. Be really proud of what you're doing. There are so many schools out there that we work with who have awesome gluten-free food programs, and it says nothing about this on their websites. If you have gluten-free menus, if you have a program for kids with special dietary needs, let the world know. Put it on your school's website, post it on social media, connect with these families. It goes such a long way just to know that you're thinking about this and that you're doing something about it. So if you're not already communicating these things or putting them on your website, I definitely recommend starting to do that. So the recommendations that I talked about, we have used them to date in 38 states that we know about, and we have used them to successfully build 504 plans in all of these states. I hope by this time next year, the entire map will be colored in green, and there may be more that have been used, but these are just the ones that we know of or have been a participant in some way or another. So we know that it's working, and we know that schools are using them well. So this is just a very great, short, thankful families video that we want to share.
Thank you for always making sure I had gluten-free options and sometimes giving everyone gluten-free food so I don't feel different.
Those are the best tacos ever!
Thank you, Chef Amanda, for making sure that if something wasn't gluten-free for lunch, that I could eat something else.
Thank you for gluten-free cookies. They're so good. And bye! Thanks so much for the gluten-free Play-Doh. You made me feel really safe.
Thank you for letting me store my gluten-free snacks in the closet when I couldn't eat the pretzels.
Thank you for supporting kids with celiac disease.
Thank you for supporting kids with celiac disease.
Families care so much, and they're so grateful to you. And I am grateful to you for learning today and for being willing to do the work to make sure that these kids are taken care of and have a really good experience at school. So I'm now going to turn it over to Deb Seisler from the Celiac Disease Foundation. The Celiac Disease Foundation has been a tremendous partner to us in building the recommendations and posting the training program online to encourage as many people as we can to learn about this. So I'm going to turn it over to Deb and let her tell you a little bit more about that.
Thank you, Vanessa, and thank you, Schär. And thank you all for being on today and just hearing about all this information that is so important to our community and our children. I wanted to introduce you to the Celiac Disease Foundation and our website, celiac.org. We provide online tools and programs to educate millions of patients worldwide who are seeking diagnosis and treatment. This includes iCare Celiac, the nation's largest celiac disease patient registry, iQualify Celiac, the world's only patient organization platform to speed recruitment for clinical trials. There is comprehensive evidence-based information in the areas of research, education, and advocacy for all things pertaining to celiac disease and the gluten-free diet for caregivers and for researchers. So if you want more information about celiac disease and the gluten-free diet, visit celiac.org. And if you want to email us, and I will put this in the information at info@celiac.org, and we'll be sure to get back to you. So one of the programs we have is called the Student Ambassador Program. And through the schools, we work with the children to empower them, all children, teens, and young adults, to become role models for others with celiac disease while raising awareness in their schools and their local community. So students in elementary, middle, and high school, and even college also raise funds for celiac disease research, education, and advocacy. So we thank the schools who support this program. And it's really a worthwhile thing for kids to really become empowered and confident in their disease and being around other children. We have a desktop site and an app called Eat Gluten-Free, which features a robust hub for all things gluten-free, including meal plans, products, recipes, and company information and services that can be accessed anywhere at any time. And thank you to Schär for all the RDs out there. We have a certificate of training in treating gluten-related disorders. And this qualifies registered dietitian nutritionists who complete the program to earn a certificate of training from the Academy of Nutrition and Dietetics and receive grant reimbursement from the Celiac Disease Foundation, again, supported by Schär, for their fees. So if you are an RD, please consider taking the training, and you will be listed in the celiac.org healthcare practitioner directory. And as a bonus, you will receive gluten-free product from Schär. And lastly, I think Vanessa covered it very comprehensively. Also on celiac.org, we have the Celiac Disease Management for Learning Environments training program. Just to recap, it instructs the schools on how to implement the accommodations required by the American with Disabilities Act for children with celiac disease and assist the physicians and patient families in structuring that 504 plan. I have the links here for all these programs. Happy to answer any questions. And again, if you'd like to email us or learn more about Celiac Disease Foundation, celiac disease, or the gluten-free diet, please email us at info@celiac.org.
All right, great. Thank you so much, both of you. So before we get into the questions, I just wanted to let you all know that we do have a landing page. I will be sharing a link after this call with you all that kind of goes through our product portfolio for food service. We have individually wrapped ciabatta buns, long ciabatta buns, and hamburger buns to kind of help you store them in your cafeterias. And then we also offer most of our products available through Dot Foods. You can order them and they come in small case counts. So sometimes that can be helpful for people, but all of the information for ordering samples and just regular orders is on that landing page. So I figured it's just easier to share that afterwards. And if you have any questions, you will have my email, but then there's also a general food service email address on that page. So now, again, I'm going to go through the questions. Deborah and Vanessa can kind of, some of them you might both want to jump in on. Just so everyone knows, there is a copy of the guidelines available through the Celiac Disease Foundation website. So we will absolutely be sharing that as well because they are hosting it. Okay, someone is asking, what about HIPAA and maintenance of the 504 physician documentation? Should the school nurse maintain that information and communicate with the school staff, or what are the recommendations for that?
Sure. So typically we share the diagnosis letter with the patient family, and the patient family will share it with the school. So the family is releasing the information to the school, and it's usually kept in the 504 file. So every school is going to have a different way of handling those materials. So whatever your school typically does for the 504 plan, for my son's school, when we registered him for kindergarten, there was a red folder that was kept in a separate filing cabinet with all of the 504 plans, and his diagnosis letter, as well as the copy of the plan, his allergy action stuff, all of that went into the same folder, and it was kept in the school nurse's office. I know in other schools I've done over 100 504 meetings this year with patient families. Everyone does it a little bit differently. Sometimes there is a guidance counselor who's assigned to manage the 504 plan. Sometimes it's an assistant principal who would handle those documents, but it will be whatever your district has assigned as a 504 plan handler who would hold those things. The school nurse should absolutely have a copy of the diagnosis letter, and it's absolutely reasonable for the food service provider to know what that letter says, because you need that information to make informed decisions about how you're going to feed the child.
Great, thank you. A few people are asking about the recording. Yes, this recording will be available on the Dr. Schär Institute website in a few days. I will also let you know where that is so you can share it with your staff. And also keep in mind, next week, we have an allergist coming on, Dr. Erin Artis-Toller, and the week after that, we have a menu planning specialist coming on. So we've got a lot of tools, I hope, to help you handle this more easily in your schools. Okay, someone else is asking, do those without symptoms experience less damage to the small intestine? Who wants to take that? Yeah.
So there is still damage in the same way as somebody who experiences symptoms. We don't know exactly why some patients are asymptomatic and others have gastrointestinal symptoms, others have neurological symptoms, others have skin rashes. We don't know the answer to all of those questions yet, but we know that they all have damage to the villi in their guts.
Great. Thank you.
I don't know if Deb wants to add anything to that.
Well, I was just going to add, which is one of the reasons it's so difficult to get a diagnosis of celiac disease, because there's over 200 symptoms, and a lot of people think of the ones like gastrointestinal when there's so many more besides that, as Vanessa mentioned. So it is difficult to diagnose, but again, when you want to learn more about celiac disease, come to celiac.org and you will learn a lot more.
Yeah, Deb, we actually have another question for you. The certificate of training in treating gluten-related disorders is from the Academy. Is it just for dietitians treating patients, or is it appropriate for a food service director to get as well?
It is just for dietitians. I know we've had some outreach from nurses and others that would like it, and maybe that's something we can think of for the future, especially if food service people need something like that. But for right now, it is just for the RDs.
Yeah, and just to clarify, a dietitian who is a food service director. So yes, I believe it's appropriate for for the food service
Oh,
director,
as long as they're an
dietitian as
RD,
well.
yes.
Yeah.
Oh, okay.
Yeah.
Yes, absolutely. As long as they're an RD, please.
Yeah.
We would absolutely want to get as many RDs trained as possible for celiac disease.
Yeah, absolutely. As a dietitian, and I've gone through the course myself, it is a really, really great tool. And I think, we don't necessarily get that training in nutrition
Right.
school. So it's important.
And by the way, it was, created by the dietitians in our celiac disease space who are very knowledgeable about the disease. So it's a very good training. And again, thank you to Schär for sponsoring.
Yes, and someone's asking if we can provide a link for training. Yes, we will be sharing all of that. It's on Deborah's slide as well. Yeah.
Yes, thank you.
Yep. Okay. If there are no more questions, thank you, ladies. So just to remind everyone, I will be sending a follow-up email with all of this information that we reviewed, a link to the guidelines, a link to the training, links to our food service landing page for the food service directors, Vanessa's information that she shared, and then I will be eventually providing a recording link once the Academy approves that for credit. So be on the lookout for probably a lengthy email from me. But it was great having you all on, and thank you so much for supporting students with celiac disease in school.
Thank you.
Thank you. Bye, everyone.
Bye, everybody.
All right. All right. And now I will share my screen. Okay. We can go ahead and get started. Erin, I'll turn it over to you.
Okay, so good morning, everyone. Thank you so much for having me. I thought this was a great topic, and so I'm so excited to be a part of this. So thank you all for coming, because it's a very important topic, and especially since a lot of you are involved directly with students and children with some of these issues. So I am happy to share a little bit of my knowledge with you to help you in your everyday life. So I figured I would just start with a couple highlights, gross highlights of food allergy. So with these two slides, it was very difficult to figure out what do I put on here because it's such a large topic. So I just wanted to hit a couple of the big points. And I think some of this will even be repeated possibly with some of the other questions, but some of the big things that come up, what are the most common food allergies? So there's really a category of 8. So milk, eggs, peanuts, tree nuts, which are completely different from peanuts, with peanuts typically and specifically being a legume, so they're different. Fish, shellfish, wheat, and soy. And so some of these can be, well, really all of them technically can be outgrown. It just isn't super common, but it's more common for people, specifically children, to outgrow milk, eggs, wheat, and soy. A lot of times this will happen by school age, but it's really different for everyone. A lot of these allergies also have been seen in association with eczema. And so that can also be a way that the allergies are increasing in terms of, just breakdown of your skin barrier. That's really our most protection against different infections and that kind of thing. And so if your skin is more open, you are more at risk for absorbing some of these proteins, and that includes food proteins. So there is a lot of crossover and association with eczema and food allergies. So with a lot of these kids, if they've got bad eczema, you may find, oh, wait, they have a food allergy. And by avoiding that food, their skin actually gets better. And so another big point I wanted to point out is that it's a common myth that you can have a severe reaction simply from touching a food without eating it. And so I thought that that was a big point to bring out, especially for school settings. There's lots of talk about how do we keep tables clean and keeping children safe, and do we have them sit at separate tables and all that kind of thing. What about the school ride on the bus? And what if somebody has something on their hands and they touch each other? So the chance of having a severe reaction is extremely rare just from touching a surface that has a food protein on it. One key thing to keep in mind is that severe allergic reactions, so we're talking about anaphylaxis, can occur by directly ingesting the food, so in your mouth, or by touching your eyes. If you're just touching a surface that has a protein on it and say it touches your skin, it's not uncommon to get a localized rash, but we're not talking about even considering to use epinephrine at that point. So it is very rare, which I think tends to be more comforting when you are thinking about a school setting. The last point I wanted to point out was, the idea that a lot of people think that it's common to have an allergic reaction to an airborne allergen. So this is actually false. It can occur most typically with seafood. So like if fish is being cooked or shellfish, there have been case reports, so not high numbers at all, but there have been case reports where once it's been aerosolized because it's being cooked, someone in the vicinity inhales it and that can trigger a reaction. So it can happen, but with a lot of the other allergens, this hasn't really been seen. So that also is more comforting, especially when you're talking about school settings and somebody opening up, say, a peanut butter sandwich and they're sitting near someone else. The risk of having a reaction is extremely low and essentially non-existent when you're talking about an airborne allergy. Okay, so next slide. And so for this, I just wanted to point out some important things to think about in terms of best practices with food allergies. So I probably will be mentioning FAIR, which is the Food Allergy Research and Education site, several times today. When I was looking over everything, I was saying, oh my goodness, I may end up being considered a spokesperson for them for how many times I'm probably going to mention them. But this is a wonderful resource when it comes to food allergies. So their website is foodallergy.org. One of the main reasons I wanted to bring them up here is they have, especially for, a lot of the schools and, we're talking about food prep and in the kitchens and all that, they actually have a FAIR check certified program where they are certifying kitchens. So looking at how to best prepare meals in terms of keeping food allergies separate, having a kitchen that is offering food outside of the big 8 food allergens. And so the things I put in parentheses are places that have kind of committed to being a FAIR check certified kitchen. So the Miami Dolphins actually teamed up with them, and they be having the food stands offering these options. Sodexo, I know that's a really big food company. Compass Group, I wasn't as familiar with, but I wanted to include it in case any of you were familiar with them. So some really big companies looking at such a serious topic. So I thought that was really good. And so the FAIR check program is also something that there are a number of other organizations that are doing this as well. And so, they do training. And so that may be something that some of you may even be interested in doing for your school, just to be sure that you are going about it the right way, and could you be doing anything better? So that may be something you want to look into as well. And then separate tables for kids at school in terms of their food allergies. Do they need to sit separate? Is it okay for them to sit with everybody else? So I wanted to list it here. I'll probably talk a little bit more about this. A lot of times I'm on the fence about separate tables because I'm super big on inclusion and having kids not feel alienated or separate strictly because of their food allergy. So, but I see the need for it. And I also think that from a, I guess, kind of a school and protection standpoint, because the school is an entity that is keeping children safe while they're away from home. It can be easier to ensure the safety if the kids are separate. So it's a very fine line. It's difficult. And then I also wanted to talk about stock epinephrine in schools, which I think also will come up later. But this is something that is possible to do. There's actually been some legislation across the country that allows this to be possible. I have not been a part of this initiative personally, but it does look like a doctor needs to give the prescription for the epinephrine, but it is possible to have it at school. There's also a number of states. So there's a nice map on the FAIR website that shows places where it's actually required to be in schools. And then it also shows the number of states where it is it's accepted to have it in schools. So it's just a matter of, okay, how do we actually do it? And the FAIR website has a toolkit that goes over a lot of the points and just trying to help navigate how to advocate for getting epinephrine in schools. So I don't know that a lot of people think about that, but I just wanted to bring it up because it is something that's possible and that's been kind of talked about over the last couple of years. So those are just some of the highlight points. And I think now we may get into some more specifics.
Yeah, so now we have a whole bunch of questions for you, both crowdsourced and some from me as well. So I guess we'll just get right into it. And again, everybody
Sure.
keep typing your questions in the question box. So the first one we have here is, what is the difference between a food allergy and a food intolerance, and are the symptoms different, and how is this different from celiac disease? Because so many of our practitioners really work in celiac disease.
Yeah. So this is a great question. This actually comes up super common because people are usually coming to me saying, oh, and people will walk in, I have a food allergy. It's like, okay, let's see, like, what are your symptoms? So before I talk about the differences in symptoms, in general, food allergy, your body made an antibody to this particular food. So every time your body sees the food, I like to explain it to my patients as your body is making kind of an army of antibodies to attack that food because it doesn't like it. So the more your body sees it, the more this army grows so it can attack it. So your reactions could get worse over time. A lot of people think that by continuing to introduce the food can actually help the food allergy go away, but that's not really the case. It can be the case when you're looking at ways to desensitize people or get their allergy to go away, which is much more involved and outside the scope of this webinar, but it is possible. When you talk about food intolerance, it's really just a difficulty in digesting food. So I think that milk intolerance is the best example of this. And so with milk intolerance, everybody's body makes a certain enzyme to break down the sugar in milk. And if you don't have enough of that enzyme, then the bacteria of your gut has to then break it down and it gives off byproducts like gas and all of that. And so you get bloating, abdominal pain, diarrhea, sometimes nausea. And so that can make it really confusing when you're talking about a food intolerance versus a food allergy, because all those symptoms can happen with food allergy too. It's just that food intolerance is not life-threatening. The symptoms can be immediate. It can be dose related in terms of how much exposure to that food you have had. And then a large difference between food intolerance and food allergy and celiac is that celiac is an autoimmune disease. So it's attacking the line, you're making these antibodies that are essentially attacking yourself, but specifically focusing on your small intestine. And so if you're getting damage to your small intestine, that's affecting absorption of key nutrients, which is why sometimes you have weight loss or difficulty to gain weight. You can have problems with or like anemia, and you can have a lot of diarrhea, which the diarrhea, you're losing those nutrients too. So abdominal pain, bloating. And so there's a ton of overlap with food allergy, but with celiac disease, well, and another key point, you can also have a rash with celiac, but the rash is different than the rash with food allergy. And so celiac, not really life-threatening the way you would think about it with food allergy. Epinephrine's not going to help anything with celiac disease. And so very different, but there is a lot of overlap with all of those issues.
Yeah, and I guess along with that, what are the most common symptoms you see with a food allergy?
Yeah, so most common can be hives. So hives can look very different. Every day I'll have different people say they have hives. I'm like, okay, but what did it really look like? So hives are just generally bumps. It's just a matter of how long was the bump there? How quickly did it show up? Was it itchy? Was it red? So in general, the way I explain hives a lot is that it looks like a mosquito bite, but they can look very different from that. Sometimes it can even look like ringworm. So the edges may be raised with clearing in the middle. But they tend to not last super long. They can move. They may be in a certain place for a couple minutes to a couple hours, and then some may show up other places. But hives are pretty common. They're always itchy. And they look different from like pimples, even though there can be some that look like heat rash, so to speak. And that can sometimes make it difficult because that's kind of what the rash from celiac can look like too, more like pimples. But those the hives are going to last much less, or at least a less amount of time in comparison to the rash for celiac. But hives are really big. You also can have oral symptoms or like swelling. So the tongue or lips could swell. So those are big symptoms. I'd say those are the most common. But when you're talking about other symptoms to look out for, vomiting, nausea, lightheadedness, dizziness, trouble breathing, all of those are possible as well. But the hives and swelling would be the most common.
Okay. And you were talking about anaphylaxis a little bit before. Is that a very common symptom, or is that just something that's pretty, isolated to severe cases?
So good question. It's I'd say it's common, and it's probably more common than people think. Technically, the definition of anaphylaxis is when the reaction involves at least two body systems. So we're talking skin, GI, so nausea, vomiting, diarrhea. It can include the cardiovascular system, so lightheadedness, hypotension, decreased blood pressure. And so you're talking about two of those. Now, if you just have decreased blood pressure, that in itself is anaphylaxis. And of course, we're talking about in close association with ingestion of a food allergen. But if you eat a food and you got just hives, that's more mild. I don't call that anaphylaxis. But if you got hives plus vomiting, now you have anaphylaxis. And I think that's part of the problem in terms of treatment, because nobody wants to use epinephrine. You're talking about a needle. And if it's not something where, oh my goodness, I can't breathe, you may not be super inclined to reach for epinephrine. And unfortunately, I see this happen a lot in emergency rooms where someone will go in, technically by definition, with symptoms of anaphylaxis, and they won't be given epinephrine. And the importance of giving epinephrine as soon as possible is the quicker you give it, the quicker it will stop the reaction. The longer you wait, the symptoms could get worse. And then you may be talking about several rounds of epinephrine to kind of get the patient back to baseline. So it's important to be able to identify anaphylaxis because just Benadryl is not going to fix your blood pressure, for example. It will help the hives, but it also can mask if there's going to be other symptoms. So repetitive vomiting, repetitive diarrhea, also are things to look out for if there are, say, hives. But two body systems, technically, by definition, is anaphylaxis.
Okay. Wow. I didn't know that about the blood pressure. That's so interesting.
Yeah. Yes, blood pressure alone. Yeah, if you see somebody, very faint looking, blue, like, oh, crap, what's going on with you? Then that person has a food allergy, then yeah, that by definition, that's enough. Give them some epinephrine.
Wow, good to know. So how long would it typically take for someone to experience a reaction after consuming a food that's either an allergen or something like gluten? I know gluten, it can really vary. I mean, we talk about that a lot with this group, but I mean, from an allergy perspective.
Yeah, so for food allergies and actually food intolerances, it can be pretty quick. Usually it could be like, so some people, if they're super sensitive from a food allergy standpoint, it could be within seconds, sometimes within minutes. But typically when I'm doing a food allergy history, I'm looking for the symptoms to start within 2 hours. anything past 2 hours, it typically isn't a food allergy. Every now and then you may hear something that sounds pretty legit that could have happened up to 4 hours, but typically it's going to happen within 2 hours. Same thing with food intolerances, again, dose dependent. If you had, a ton of ice cream, typically it's going to start within 2 hours. And again, the main reason why it's difficult to differentiate intolerance from food allergy. Celiac is also difficult because I have a lot of people coming in saying, well, I have a gluten allergy. I'm like, okay, so what are the symptoms? What happened? Another symptom that I didn't talk about with celiac, not necessarily celiac, but like intolerance when people are talking about gluten, because I feel like gluten is a really big umbrella of symptoms and diagnoses. And headache is something that comes up a lot for that too. So headache and rash and abdominal symptoms. And so with that, a lot of people will report having it in a row for a couple of days, and then the symptoms will start. So the timeline is really important when you're talking about what is the underlying issue and what's the severity and what do we really need to rule out.
Okay. So are there any groups that you've identified that are more at risk for severe allergic reaction to a food? Do you see that more in different age groups or anything like that?
So not necessarily, I would say. So a lot of times the school forms will have on there, a box to mark off, does this patient also have asthma? And I think that is a way to kind of identify or flag a student who may be more at risk for a more severe allergy. So I feel like sometimes that can be misleading, because just because you have asthma doesn't mean that if you eat the food that you're allergic to, it's going to cause an asthmatic type of reaction, which of course would be very concerning. But I think the people who are most at risk for severe allergic reaction are people who have actually had anaphylaxis in the past. And so I have seen a number of school forms that will have that on the form. Did the patient actually have a previous severe reaction? Because a lot of people haven't. Like I just saw a patient yesterday who touched a crab leg and got like a red blotchy rash. And the same thing happened to him with peanuts. So he's allergic, but he's never had a true anaphylactic reaction. So I don't think that there's really a way to know if somebody's at risk for a severe allergic reaction, whether it be, infant, child, adult. It really has to go more on, okay, what was your reaction upon exposure to the food in the first place? But overall, that reaction can get worse over time, because if your body keeps seeing it, again, going back to my army analogy, the army will continue to grow. So if your body keeps seeing it, you can get a more severe reaction. So the best way to outgrow an allergy, and maybe this is leading into another one, but the best way to outgrow an allergy is strict avoidance, to give your body a chance to forget that it doesn't like the food in the first place.
Yeah. And so I do want to kind of ask you a little bit about that, because I'm seeing, as a dietitian, I'm seeing a lot of people who are challenging certain allergies. And so if you're saying that the best is strict avoidance, like how does that work? I guess, what can a person outgrow their allergies, and in the short way, what might that process look like?
Yeah, so it's possible. And again, kind of what I had touched on the slide in terms of like milk, egg, wheat, soy, a lot of times can be outgrown. Wheat isn't a super common allergy. I think I have one patient that has a true wheat allergy. But the best way, strict avoidance. So your body doesn't see it over time, the sensitivity will decrease. So again, those allergy antibodies will start to decrease, and you may be able to tolerate it again. Outside of that, so like peanut, tree nut, a lot of times those are not outgrown. I've seen peanut outgrown a number of times. The tree nuts, not so much, but it also depends on how severe your sensitivity was to begin with, in terms of how high is that army of antibodies. If it's super high, the chance of it going away is pretty much slim to none. But again, yes, the best way of having it go away is for your body not to see it anymore, because when it sees it, it's like, oh no, the amount that I had wasn't enough. Let me make more so I'm better prepared next time. So the more your body doesn't see it, it can actually start to decrease and dwindle over time. I will have a conversation with patients about, okay, let's not continue to introduce it, which can be a difficult conversation. Not everybody feels comfortable with introducing foods at home. Some people are more cavalier about pushing the envelope, like, oh, I have epi, we're okay. But it really depends on how much time is in between. So like if you had a reaction 6 months ago, there's no point to try now. A lot of times we're talking about retesting every 1 to 2 years, because it does take time for those levels to decrease. But on the flip side, when I talked about desensitization, which is a process, so like there's a lot of peanut trials going on right now. A lot of children's hospitals are really the ones who are manning this initiative because it takes a lot of manpower. But essentially the process is, if we give you small amounts of this protein that we know you're allergic to on a strict regimen, we can train your body not to be allergic to it anymore. And so it's huge. And a lot of families are interested in this because the whole fear of what if you're out and you mistakenly have something. So when I talk to my patients about considering this as an option, I have a real conversation about, okay, what are your goals? What is your outlook for going through this process? Because it's one thing to say, I want to have the peace of mind that you're not going to have a severe anaphylactic reaction if you accidentally ate one peanut, versus I want to sit here and just eat a whole bag of peanut M&Ms. And so I think those are two totally different things. And the process is very tedious. You're talking about minuscule increasing amounts of peanut protein. You know you're going to have a reaction at some point because you are significantly allergic, which is why you need to have a lot of manpower. A lot of times you're increasing the dose at home. So you need to be able to call somebody and say, hey, these are my symptoms. What do I do? And so that's why a lot of places don't do it. But in the end, the goal is I can eat 1-3 peanuts without any issue. And there's some other places doing this with like milk and egg. It's just that nothing is standardized. So that's why it can sometimes be hard to even find these programs. You need to meet certain criteria for them to accept you into these programs. But that's kind of the idea behind desensitization and making somebody not allergic to their food allergy anymore. But there's still needs to be tons of research done on that.
Yeah, and what about food intolerances? Do you find that that's something that people can outgrow?
Yes, but I think that it depends on what the food intolerance is. So for example, milk intolerance, typically not something that's outgrown. Once your body kind of decides we're not making any more of this enzyme, that's kind of it. Thankfully, there are alternatives like lactate products, which work pretty well for a lot of people. But other food intolerances, for starters, it's very difficult to identify. There are tests that I warn people not to waste their money on, and the main reason is because these tests are blood tests. Sometimes they're saliva tests, sometimes they're even hair tests, I've heard, where they're looking at showing what food are you sensitive to or intolerant to. But the problem is that these tests are testing to IgG. IgG is a certain antibody that everybody makes, but it's our memory antibody. So if you get a flu vaccine and you want to see if the flu vaccine worked, you're checking for IgG. So that way you have a pool of IgG to attack the flu when your body sees it. So the idea is that it's a memory antibody. So these foods could look elevated for an IgG level because you ate them before. So sometimes people will get these tests and they have foods that are super high on IgG level, and it's food they've never eaten before. So the test, the idea behind the test makes sense, but it doesn't really correlate, and it hasn't been proven clinically, which is probably why most insurance companies don't cover it. So you have to pay out of pocket, and it's not super cheap. So I recommend against that. But I started there because it can be super difficult to figure out what the food intolerance is. So I do have a conversation with a lot of my patients about keeping a food diary, that you're also tracking your symptoms. So that way it can become overly apparent. Oh, what did I eat? Oh, okay, this is what I need to avoid. And you avoid the food, your symptoms go away. If you add the food back in, do your symptoms come back? Okay, great, avoid this food. So over time, it's possible for the food intolerance to go away. I haven't seen it much, but probably because I'm talking about food allergy most of the time. But I do think it would take, it takes a lot of time. Sometimes food preparation could come into play in terms of why you're not tolerating the food. You may be able to identify it down to a certain ingredient. But I think that food intolerance, just like celiac, not super common to be outgrown, just the way that your body is becoming sensitive to these foods in the first place.
Yeah, absolutely. Before we shift gears to the schools questions that I have, um, do you find that the number of people with food allergies is increasing? And do you know why that is at all, if that's true?
I think overall, if you're looking at the number of people with food allergies in comparison to, say, probably 20, 30, maybe even 50 years ago, yes, it has increased. Part of that, I think, always has to do with diagnosis. So over the years, our diagnosing strategies have improved. Reporting, are people coming in saying what their symptoms are? But outside of that, there hasn't been anything definitive to say why it's increasing. There have been a lot of theories. Probably the largest one is the hygiene hypothesis. So we are a very clean people, especially over the last year or two, and everybody and their mother has like 5 hand sanitizer bottles probably on in their purse. And so we're very clean. And so the idea is that you're not being exposed to as many allergens at younger ages. And so they had studies that showed people who lived on farms really didn't have very much food allergies. And so that's kind of where that thought came from. But again, nothing has really been proven definitively. There's been a lot of back and forth in terms of early introduction of foods to help decrease food allergies. But because of that, a lot of mothers are concerned. If you already have a child that has a food allergy, you don't necessarily want to give the second one the same food. Even though a food allergy is not a one-for-one thing, if somebody in the family has a peanut allergy, it does not mean other kids in the family are going to have a peanut allergy. They're probably going to be allergic to something, but it could be pollen, it could be a medication. So it's really an umbrella of allergies. It's not a one-for-one thing, but I think in general it is increasing, but there hasn't been able to be a way to really kind of pinpoint one underlying reason.
Okay. Yeah, I get asked that question a lot with celiac disease too, and I think that you hit on a lot of good points, and especially the diagnosis part. I think we kind of, as you get better at diagnosing things, you're going to have increased incidence, which
which I'm quite sure has probably come up a lot too, but I meant to mention this when I was talking about the difference between food intolerance and food allergy. Food allergy, you don't have to be eating the food to be able to be diagnosed. But celiac, you do, in terms of helping to really prove that that's really the underlying diagnosis. If you don't have gluten or wheat in your diet, it's going to be very difficult to get a good, reliable diagnosis. So even though we've come a long way in terms of diagnosing, you still need to be eating the food. And it's kind of like, well, I don't want to eat the food because I don't feel well. So it's difficult.
Yeah, absolutely. That definitely comes up. All right. So shifting to the schools a little bit, because I think this audience really is largely a school audience. What are your recommended best practices for avoiding allergen contamination in a school kitchen? And are there resources that you specifically recommend? I know you mentioned Schär, but maybe you could redirect people to that, and I'll share the website as well.
Sure. So the Schär check that I was talking about before, they have different training programs to really look at, okay, how can we allow or give food options outside of the big 8 food allergens. What does working in the kitchen look like? In terms of, if there are going to be allergenic foods, keeping it separate, what are the best practices for how to do that? And so I think that is really a great resource and a nice standard way to look at how a kitchen can function when you're really trying to be all inclusive. Outside of that, I think the more specific things to look at is just, keeping the food separate, having utensils that are designated for a food allergen area, making sure surfaces are wiped down, and you don't need any strong chemicals, really just soap and water, and keeping the surfaces clean. It is really, so for the most part, it can be done relatively easy, but it does definitely take paying attention to detail in the kitchen.
Yeah, and what about in the cafeteria or classroom? I know we sort of touched on this, but can we talk about the separate tables? Do they really need to sit at a separate table? Are the kids with food intolerances a little different? So I don't know what your best approaches are.
Yeah, so as I said before, really big advocate on inclusion, not having a child feel alienated just because, unfortunately, they have a food allergy. I think the food intolerances, really, there shouldn't be any issue in terms of them kind of being intermingled with kids who don't have food intolerances. I think the separate table really is, let me back up. I think it also depends on age. If you're talking about daycare and kids picking up, different foods, different story. But with school, a lot, by the time, kindergarten, first grade, it's kind of been drilled into their head what they can and can't have. And a lot of these kids are very overly aware of asking before they have things that they haven't had before. And so personally, I don't ever recommend that somebody sit at a separate table, but I do think it's an easy way for the school to help manage and identify who are the kids I need to be aware about being at risk. It's a way for parents to feel more comfortable. I know a lot of these schools will have where, okay, if you're going to sit at a say peanut-free table, you can bring a friend with you, and that family also knows, okay, you're not going to have any peanut foods. So I think it's a good way to have a workaround, while still having the child feel included. But I think it's really just preference. And so it just depends on, is the school a peanut free or whatever free school, where you don't have to even talk about that, versus having a way to have it be easy to identify these kids and keep them as safe as possible.
Yeah, definitely. It's a tough one.
Yes.
So how do you handle that communication with a school about managing a food allergy? What are your recommendations for the parents? Do you get directly involved?
So I haven't needed to. In general, a lot of times, most of my communication is just with the school form. What are they allergic to? What are the symptoms we need to look out for? What medicine? When should the medicine be given? What are possible side effects from the medicine? Every now and then there'll be some situations where there may need to be special, IEP or 504 plans to further protect the child. And so my mom was a principal, and so we had a lot of conversations about some of these plans. And I always kind of questioned, okay, who's the one giving the diagnosis? Because touching back on the myth about, can you have a severe allergy by just touching a surface or, airborne? Then I kind of look at, okay, well, was it an allergist that this family met with? So that way they know what are the true risks. And so that I think can be definitely beneficial when it comes to a school. So I think for the most part, I haven't come across any of those issues because I do a lot of educating with my families. And so there haven't been any issues with schools, but for the most part, my communication has just been through those typical school forms. But I know that there are some places where doctors may need to be a part of those meetings when they're formulating the plan, and what does the school need to do as a part of those plans to help protect the child.
Yeah, and kind of along with that, do you see any disparities among how schools are handling food allergies and food intolerances among students? And do you see any major areas where we kind of need to be focusing our efforts to improve things for these kids?
I think part of that comes into, well, I guess at the end of the day, everything comes down to money. And so, if you're looking at private versus public schools and what foods are offered, what resources do they have in terms of the sheer number of, say, aides in the cafeteria, in terms of being able to kind of keep an eye on what the kids are doing. But that's really just a generalization. I haven't personally seen any of those things, but I think those are things to keep in mind. From a further breakdown, not necessarily from a school standpoint, but when you're talking about like socioeconomic differences, do these families that have kids with allergies or intolerances or celiac disease, do they have the means to pack a lunch? And means, whether that's money or options for foods, and do they have the education to know, okay, you're going to go to school and these are the things that you should eat. If you're picking food from the school, these are the things you should have. And so I think that nothing comes off the top in terms of more that schools can do. But I think that the plans really give a chance for the family to sit down and talk about what can the school do to help the child with this situation.
Yeah, definitely. So I guess, what are some of the biggest challenges that you see for these kids? And then we'll kind of get into the participant questions. We have a few.
So you said the biggest challenges. So I think really at the end of the day, being able to have food security, getting the nutrients that they need, and feeling comfortable enough to actually put the food in their mouth. There's a lot of times where we get to the point where we think that a child has outgrown a food allergy, and here we are, their entire life we've been saying, okay, avoid this food, and now we're saying, okay, eat the food in the office. And it's a really difficult thing for kids to wrap their head around. And so there can be fear ingrained in them because of eating foods, and anxiety about what will happen. And so it's really, it's a whole part of life. And so feeling comfortable and feeling safe to be able to eat, having your kind of your circle of people that you're with, other families, having them understand. When it comes to tree nut allergies, when I tell parents, okay, you're allergic to such and such nut, at home, okay, maybe you're not allergic to all tree nuts. It's okay for you to give them, say, cashews if you're allergic to pecan. But if they're out with other people, I tell them, just tell them they're allergic to all tree nuts. You don't want to have to rely on someone else knowing the difference between each nut. So there's a lot of things that come into play with it, but I think that the biggest difficulty for children is food security and feeling comfortable when they actually sit down to put food in their mouth.
Yeah. So how do you encourage or explain to staff the importance of taking a food intolerance or sensitivity just as seriously as an allergy? Because I think a lot of times specifically with gluten, again, we have a lot of gluten specialists on this call, people don't take it as seriously when, as of course, it is. So I don't know. How do you explain that to people?
So that's a really good question. I think that it can be difficult to wrap your head around it because you're not talking about life-saving medication and the potential of needing epinephrine. So it's easy for people to let their guard down. It's also easy because it's not something that's going to be an issue right now. It's more of an ongoing process. And so, okay, just because I had gluten right now, my hemoglobin's not going to drop. But it could be a problem over time, and the weight gain issue. So I think that when you're pointing out somebody has a food intolerance or celiac disease in comparison to food allergy, it's just as serious because it can start to affect schoolwork and focus. When you're not getting the nutrients you need, it affects everything. And so it's just as serious. You're just not seeing it, and you can't do anything about it at this moment to reverse it. And it's not reversible. So I think when you point out to people that, okay, yes, there's no life-saving or immediate treatment, but that you're talking about more long-term issues, that's the way to really kind of drive home the point. This is just as serious. But it's difficult for sure.
Yeah, and we have a question here about asymptomatic celiac disease. Would you please discuss it? And I think from my side, just to give you some context, we
Mhm.
get a lot of people who say, um, they don't have any symptoms when they consume gluten, and that makes the buy-in from school staff and other individuals a little bit harder. So would you discuss a little bit about what that is, if you could, and then again, just re-emphasizing the points about how to navigate that and communication specifically for a pediatric patient. I think it could be really
Mhm.
difficult for a child in that setting.
Yeah. So I think that first and foremost would be the education behind it and who's doing the educating. A lot of times we as allergists are involved in something like this. So hopefully it'll be really important for a GI doctor to really kind of hone in on, okay, what does this really mean? So in general, asymptomatic celiac disease would be where you're not having your typical bloating and diarrhea and all of that upon ingestion of gluten. But the testing is there. And so like the proof is there. And so if we're talking about getting buy-in from, and you're talking about from schools, you said, right?
Yeah.
But,
Yeah.
okay.
We'll keep it to schools.
Okay. I think that a lot of times I'm really from the mindset of giving the information that's necessary for whatever the process is that needs to be done. So what I mean by that is keep people on a need to know basis. I don't think that it's necessary for a school to know what the specific symptoms are. I think they need to know what symptoms to look out for, but I don't think they need to know X child doesn't really have symptoms. All you need to know, they have celiac disease, and these are the potential symptoms that could happen. And yes, you may be asymptomatic today, but if you have a large enough load of gluten, at some point you may actually end up having symptoms because that's really kind of the process of how celiac disease works. So if you keep it at a standpoint of this is celiac disease, this is what they're at risk for, I don't think you really need to worry about getting buy-in because this is what it is and it's written on paper. Once you have it on paper, that this is what we're falling back on. So, and I think just the other part of it, trying to get them to understand, because if they do understand, then it will be easier to proceed. But just letting them know, okay, fine, like right now there are no symptoms, but that doesn't mean there won't be symptoms forever.
Yeah, definitely. I also, I'll always say to people, just like you said, it doesn't matter what the symptoms are, the damage is still being done. So it's a huge problem we see with gluten intolerance, celiac disease specifically. But yeah, those are good points. I want to circle back a little bit to communication with a child, because I think particularly with young children, it's really difficult for them when they go to school. And I think for parents, that can be really anxiety inducing. So
Definitely.
how do you educate parents and then children how to advocate for themselves?
Yeah. So we do a lot of talking about food ingredients and looking at lists and talking about, foods that are, say, made in a factory or on shared equipment versus foods that, actually are listing it in there. And so first and foremost, I always have a lot of education with the parents about the concern if the child is still eating the food, because again, you're still getting exposure, even if it's not enough, kind of like asymptomatic celiac disease. Even if you're not getting enough of the protein to trigger a reaction, it can still be causing damage. Again, like going back to that pool and army of antibodies. So the more your body sees of it, the more problem it can be. So once people understand that, the next part is understanding where are these ingredients being hidden. And so FAIR, again, has a nice list of foods that people may not always think about that may include the allergenic food that you need to avoid. And so that's a nice resource to reference. And then depending upon the age of the child, and that's one reason why it's so important to meet with the allergist like once a year to go over, are there any new questions? Did you have any accidental exposures? How did it happen? What to look out for? Definitely with school age, depending upon how old they are. I also have the conversation with the child about kissing, not knowing what somebody else ate, and is that going to put you at risk? And so it's very important to involve both the child really at any age, because they may have questions too. But in involving the child and the parent in terms of all the education necessary for how to avoid their foods. But the food ingredients on the labels is a really big one.
Just want to circle back to the kissing for a second, because we get this question a lot in the celiac world, and there's no data on how much gluten transfers through kissing. So could you tell us for the food allergies, how you manage that?
Yeah, so a lot of times first and foremost, I think it's important to point out that that is a way that the food allergen can be transmitted or can be ingested. And because again, ingestion, mouth or eyes. And so lips, you then lick your lips afterwards, that could be enough to cause a reaction, but it really depends on how sensitive you are. If you can tolerate a large amount of protein, likely kissing somebody who just ate something is not going to be enough to trigger a reaction, but it's definitely something that should be thought about. And so the way to kind of help manage that is knowing who you're kissing, and knowing, or at least having an idea, what did they just eat, brushing your teeth, washing your mouth and your face, around your mouth, just to help ensure as much as possible that there's not going to be any transfer of protein.
Yeah, so teeth brushing, mouthwash, that's really the best way to clear it out.
Yeah. Mm-hmm.
Okay.
And just, soap and water, just topically, because that's really recommendation when it comes to like surfaces, for example. Mm-hmm. Soap and water really tends to be good enough. There was actually something that I looked at in preparation for this. It was talking about like hand sanitizer, not enough to really get rid of the protein, but just going back to soap and water. So just washing the area should help.
Yeah, it's interesting. We've done some studies, or we partnered with some people who've done studies on for gluten and cleaning, and really washing works. Soap and water is the best way. We've seen the wipes not as necessarily as effective. Yeah. Hand sanitizer, it's just soap and water seems to be the best mm-hmm. way to clean things. So,
which is great since it's nice and cheap. Everybody can get soap and water.
Yeah, definitely. Okay, so I don't think we have any more questions. If anyone wants to type anything last minute, go ahead. This is your last chance. Thank you everyone for coming today. As a thank you for your attendance, you will be entered for one entry to win our food allergy kitchen or food allergy safe kitchen set. So that's really exciting. Everyone who attends the webinars gets one entry into that raffle. We will be raffling off 3 of those prizes, and hopefully you can win something nice for your school. So that's really exciting. As a reminder, I'm going to be sharing all of the slides. Eventually, I will be sharing the recording. And if you have any questions, you can just respond to the email that you get from me after this. You'll get your certificates. You'll also get a link to our food service landing page where you can directly see all of our products that are available in the food service packaging and which allergens they contain, because we understand that there's a lot of crossover with celiac disease and food allergies. And so we try to be free from a lot of the top 8 allergens. And so you'll see that reflected on some of our packaging. So again, that'll be shared in the follow-up email you'll probably get from me later today or early tomorrow. So thank you, Dr. Toller-Artis. This was amazing. Okay. I think I learned so many new things about food allergies, and I think
good.
I'm hoping everyone else did too. So we loved having you, and we really appreciate the time that you spent with us today.
Sure. Thanks so much for having me.
Yep. All right. Bye, everyone.
The school nutrition industry since 1994 and was founded by 2 of the most respected professionals in school food service, which is Gertrude Applebaum and Dot Purnell Martin.
InTeam has decades of knowledge of experience in creating standardized food systems to help schools develop successful school meal programs, and they literally wrote the book on school food service management. InTeam has incorporated their philosophy and best practices into an integrated suite of software applications, which includes menu planning, which we actually have available at no cost annually. And we also have inventory, online menus, mobile pre-ordering, and e-learning to help school nutrition departments address the challenges of running an efficient operation. I have provided my contact information at the bottom of the slide for any of you that may be interested in learning more about InTeam software, and then I'll also have it again at the end of the presentation. And a little bit about, hold on one second, let me move this so I can switch slides. I'll tell you a little bit about my background. So I have been working in school nutrition since 2013, and I've been working as a consultant for InTeam for 6 years now. I primarily manage InTeam's e-learning platform, and I also help with school onboarding and implementations of our menu planning software. I started in school nutrition working for the Kentucky Department of Education, where I assisted on administrative reviews, and I trained SFAs on menu planning. And I also have experience as a food service director at a small independent district in Kentucky. So I am familiar with the daily operations at the district level. And I graduated from the University of Kentucky in 2011 with a degree in human nutrition. So we will start off this webinar by discussing why school food service must accommodate special dietary needs. And not only is it good customer service for you to meet the special dietary needs of your students, but there are also many laws that require it. For all entities that use federal funds, accommodating special dietary needs is a matter of civil rights. Protected classes include race, color, national origin, age, sex, and disability. Disability is the class that special dietary needs falls under. So what is a disability? According to the ADA, the term disability is defined as a person with a physical or mental impairment that substantially limits one or more major life activities, a person who has a record of such an impairment, and or a person who is regarded as having such an impairment. So major life activities include seeing, hearing, walking, speaking, learning, reading, eating, and breathing. And major life activities also covers major bodily functions such as digestive, immune system, respiratory, circulatory, and neurological or brain function. Because these are very broad categories, most physical and mental impairments constitute a disability. So federal law and regulations require school food authorities to make reasonable modifications to accommodate children with disabilities. This includes providing special meals at no extra charge to children with a disability which restricts their diet. So how does an SFA know if a child's condition meets the definition of a disability? The answer is, it is not the SFA's responsibility to determine if a condition is a disability or to investigate if there is any possible abuse of the process. It is the SFA's primary objective to provide reasonable modifications, otherwise it could be considered disability discrimination. If a requested substitution does not fall within the meal pattern, a medical statement is needed, and a 504 plan or an IEP can substitute for a medical statement if they have the required information. You have probably noticed that I keep saying that SFAs must make a reasonable modification. We will look at what qualifies as reasonable. A reasonable modification is a change or alteration in policies, practices, and procedures to accommodate a disability. It is the SFA's duty to negotiate over modifications. This means that simply saying no is almost never appropriate. Modifications should be individualized on a case-by-case basis. What may work for one student may not work for another with the same impairment. The modification requested should be related to the disability or limitations caused by the disability. For example, if a request is only due to gluten intolerance, then a parent should not also be asking for peanut-free submissions. It is important to note that the modification requested does not have to be the modification provided. For example, a parent may request that you provide 3 different gluten-free menu options, but it is satisfactory if you have at least 1 gluten-free option. Another example is if you receive a medical statement for a child with gluten intolerance that requests a specific brand of gluten-free bread. If a modification request indicates a brand name item, in most instances, a generic brand is sufficient unless the brand name is medically necessary. This can be determined through an interactive process with the child's parent or guardian, but in general, when managing special dietary needs, you do not have to provide name brands. SFAs must still accommodate to the best of their ability, even when the person requesting modification believes more should be done. So it is rarely acceptable for an SFA to refuse to make a modification to accommodate a child's disability, but there is an exception to this. For example, modifications are not required that would fundamentally alter the nature of the program. An example of a time when a modification could fundamentally alter a school nutrition program is if a student has diabetes and needs to eat regularly, but the school does not have the school breakfast program. The SFA is not required to provide or start the school breakfast program, but they may still be responsible for providing the student with a breakfast meal. SFAs are advised to consult with USDA before relying upon this exception. It seems that offer versus serve could be used to avoid items that students are allergic or intolerant to. However, OVS cannot be used as a method to accommodate students with disabilities by eliminating food components. All students, including those with special diets, must be provided the opportunity to be offered and decline all meal components. And as I mentioned earlier, a medical statement is not required to make substitutions within the meal pattern. But the great thing about the meal pattern is that it provides a lot of flexibility, and most modifications can be made within it. It is very important for SFAs to be proactive and design a meal plan with the meal pattern to accommodate the common food allergens. In the remainder of this webinar, we will focus on planning a menu with gluten-free options. Since this is the last webinar in this series, by now you are all probably pretty familiar with the definition of gluten. But as a quick review for those that are just now joining us, gluten is a protein that is found in wheat, barley, rye, and their derivatives. It is commonly found in flours, breads, pasta, crackers, cake, and cookies. It is important for SFAs to be aware of other items that are not as well known for containing gluten, but are commonly used in school meal service, such as soy sauce, seasonings, gravies and sauces, broth, pudding, seasoned rice mixes, oats, unless specified, gluten-free, veggie burgers, deli meats, hot dogs, sausage, salad dressings, croutons, and more. So because there could be hidden sources of gluten out there, it is important for program operators to know how to read labels and check labels for ingredients that contain gluten, because FDA regulated foods do not have to be labeled as gluten-free. It is voluntary for manufacturers to label foods as gluten-free. When reading labels, you will need to look for the following FDA regulated terms: gluten-free, free of gluten, no gluten, and or without gluten. It is voluntary for manufacturers to include these labels, which means that they must meet the regulations to make these statements. But because the gluten-free label is voluntary, there may still be other gluten-free products out there, so knowing how to read a label is important. When checking ingredients that contain gluten, you will want to look for the following: wheat, barley, rye, malt, brewer's yeast, and or oats, unless the oats are specifically labeled gluten-free. Remember that just because an item is wheat-free does not mean it is gluten-free. So it is important to research your ingredients. If a label does not identify an allergen or other ingredient, then the SFA must contact the manufacturer. A best practice for schools is to include in their bid specifications that allergen information must be provided for their bid items. So now that we have covered how to avoid foods containing gluten, let's talk about foods that you can serve. For gluten-free diets, program operators may serve gluten-free versions of grain, such as gluten-free bread, buns, pastas, and pizza crust. And you can also opt to serve naturally gluten-free foods, such as corn, so corn chips, corn tortillas, buckwheat, quinoa, brown rice, and wild rice. It is recommended for schools to mirror the planned menu options when possible. So similar meals promotes inclusion for those with special diets and helps provide a variety of meal options for a nutritionally adequate diet. Looking at several examples where you could mirror the menu plan is by using gluten-free buns or bread when serving hamburgers or other sandwiches. If you are having pizza, you could order a gluten-free pizza or use gluten-free crust. Gluten-free crust. If you are serving pasta, there are gluten-free pasta options. And if you're serving tacos, you could use corn tortillas. At breakfast, you could have a gluten-free cereal option such as Chex. And there are also gluten-free muffins and pancake mixes out there. And another easy gluten-free option is fresh foods. There are a lot of naturally gluten-free foods out there, including vegetables, fruit, rice, and lean meats. Another helpful tip is to save the extra portions when preparing gluten-free items, such as your gluten-free muffins, so that way that you always have gluten-free options on hand. So cross-contamination is something that food service staff should be trained and educated on. As a general rule of thumb, it's best to keep it simple and separate. Use separate equipment and prepare special diet meals in a separate dedicated location. Clean and sanitize all utensils, equipment, and surfaces. Be mindful of the common cross-contamination situations, which include storage areas, serving racks, knives, salad bars, tongs, and even gloved hands. A best practice is to assign staff members for special dietary needs. Provide them with additional training resources on special dietary needs and cross-contact. Have them become an advocate for the special dietary needs students and allow them to meet with the student, parents, and 504 coordinator. Having dedicated staff allows them to focus on providing safe meals and allows them to connect with the special dietary needs students, which makes them feel safe and protected. With my experience working at a school district, I know that it can be overwhelming to keep track of the ingredients of each item that you've ordered to track what allergens are on your menu. Your menu planning tool should make this easier for you. InTeam's menu planning tool is connected to a global database with over 70,000 food products, along with the item's nutritional, crediting, and allergen information, so you can easily pull these items directly into your recipes and menus without having to track the ingredients list down. So, for example, if you were interested in looking for gluten-free food items to put on your menu, InTeam's menu planning system would allow you to type in Schär's into the search box to generate a list of Schär's products, or you could even type in gluten-free for hundreds of gluten-free products. InTeam's menu planning system even allows you to easily create new gluten-free recipes by swapping out ingredients for comparable gluten-free options, which you can see on the screen. And on the left side of the screen, you'll see an example menu built out in CN Central with a regular cheeseburger and a cheeseburger on a gluten-free bun. On the right side, you can see one of our standard menu reports that lists all of the allergens found in each item along with the carb count. Reporting like this makes it easy to communicate to your nutrition staff what allergens are on the menu for that week. Menu transparency and communication is very important for special diets. InTeam's menu planning tool has an added on option of Choosy online menus, which is a mobile app and website that parents and students can view the menu and the allergens and nutrients for each item. The allergen and nutrient information comes directly from your InTeam menus, so you don't have to enter the data twice, and you can be assured that the allergen information is accurate since it is coming directly from the manufacturer. Choosy also allows students and parents to pre-order meals. Pre-selecting foods is a best practice for special dietary meals and a great way to ensure that students and parents are involved in the selection process, which gives time to the school nutrition staff to notice if a restricted item was accidentally selected. InTeam also has a free resource available to all schools, which is our cncentralrecipes.com website. This website has hundreds of recipes, including some Schär's recipes. You can scale and download these recipes to meet your district's needs, and all that is available at no cost. So on the next slide, you will see in the search box that we had typed in Schär's, and it will generate a list of the Schär's recipes. So make sure to go visit this website and download some of Schär's recipes so that you have more gluten-free meal options at your school. And then last but not least, of InTeam's software suite, we also do have e-learning. InTeam actually started out as a consulting company, and we have put our trainings into digital form and have an e-learning platform in which there are over 20 different courses that cover a variety of school nutrition topics, which includes civil rights and special dietary needs. We also have other courses like procurement, verification, etc. Our courses on average are about 30 minutes long, so it's really easy to fit into your day, and then you can also take the trainings while you're at home. Our courses are compliant with USDA professional standards requirements, and InTeam e-learning can be purchased as an individual license or for all of your school nutrition staff under a district license. And for those that do purchase as a district license, you could be set up with admin access so that the food service director or managers could manage their staff. They could assign courses and monitor compliance. And that went really fast. So on this slide, hopefully you all have some questions. I just want to say thank you again to Schär for inviting me to speak on this webinar series. And thank you to all that have attended, and good luck on winning the free school supplies. For those that are interested in learning more about InTeam's products, please use my email that's listed on this slide. And I'd be happy to show you all a demo or give you some pricing. Like I said, the menu planning is available for free. So I guess this will go into the question section.
Yes. Okay. Thank you, Rachel. That was great. So I have a few questions. Some came directly to me, some were sent before the webinar, and then we have some in the Q&A. So I'm pulling from a lot of places. So bear with me. Okay. In your experience as a food service manager, what are some of the biggest challenges you've seen for accommodating children with special dietary needs, and how do you typically go about addressing those?
I think so. The building that my office was in was an elementary school, and so I can speak a little bit more towards the younger kids. And I think one of the biggest challenges is you're trying to get them through the line so quickly. So I think just being aware of if it is a kid that's coming through that has a food allergen, especially one of the younger kids that might be new to the school and a little bit shy. I think it's really important for food service to be involved with the teachers, the kids, the parents, so that way they're recognizing those kids and able to make sure that they're getting the items that they're allowed to have, and avoiding the ones that they're not. So I think that's probably the biggest challenge, is just identifying them as they're coming through and making sure that they're not getting something that they shouldn't be. So I think that's where pre-selecting your menu options and having those prepared, so that way when the child gets there, you're ready to hand that out to them. And also having that dedicated staff to be paying attention to that, and so that they're on the ball when they see those kids coming through, that they know that they have a meal set aside for them.
So sort of on the educating the staff, I know you mentioned that you feel, of course, staff need to be trained and on a regular basis. And do you have any recommendations for that? And is there a need for a more standardized training for food service providers?
Yeah, of course, we have our e-learning, and we do have a special dietary needs course. It's a 4-part series that talks about not a lot of stuff that was covered in my presentation today. So it will talk about the regulations. It talks about the 504 coordinator's role, the school nurse's role, food services role a little bit more in depth. And so I think that course is really great. But there's lots of good training sources out there through the Institute of Child Nutrition, ICN, and also, the food safety courses that food service staff are required to have, and surf safe courses. I think those would be also a great one. I need to kind of go back to my question earlier that you'd asked about one of the biggest problems or the hardest things in school nutrition, not only when students are coming through the line, but keeping track of all the ingredients and allergens that are in the products that you're ordering. So I definitely think that is something that requires a lot of work for a food service director to keep track of, especially if you're having to do that manually, if you're having to go, look at each box and that. And so I do think that's why your menu planning system, whether our software or someone else's, is really great if you can have that information coming directly from suppliers. So that way, if you miss something, hopefully, the supplier has published that information, so you can keep track of it that way. And it's all like an automatic process. So how that works with us is that we actually get a list of your bid items that you would have through one of your suppliers, and we import those into our system, and we run a match against the manufacturer's database. So that's how we can get all that information easily.
Okay, yeah, because we do have a couple of questions. How does the software capture real-time product substitutions by food suppliers? So you kind of just answered that, but if you could maybe expand a little bit.
Yeah, so we also have that, like I mentioned earlier, that swap feature. So we would have your list of bid items built into your item database, but then we also have a global database of products out there. So if you weren't able to get a specific product from your regular vendor, you could go into the database and kind of do some shopping around. So that way you could find that product. It's not just limited to your supplier. There's over 70,000 different products in there. So that makes it really nice to find comparable substitutes for any items that you might be out of stock of, or need to switch out quickly. And with our software too, we have that item database that you build out first, and then you enter those items into your menus. And so if you were to make an update to one of your products within the item database, it feeds that out into all of your future menus. You don't have to go, enter your menus and track down where you have that item. So that makes it, takes a lot of work off of the directors or the menu planners. So that way, it's all an automatic process. It feeds out into production records, into the menus, into the online menus.
Great. So how often do the SFAs have to update the recipes to keep them up to date with, because there's always manufacturer product ingredient changes and stuff?
Yeah. So typically, when I used to work for the Department of Education, we would suggest at least annually to be updating your recipes with your new products, the new items that are on your bid. But we also do have like a generic database in our system. So if you were wanting to use like an average of products, if you were wanting, for example, fresh fruit and vegetables or canned fruits and vegetables or flour or something like that. So that way it's not tied to a specific branded product. If you were just, wanting some generic ingredients in there, you could use something like that. And then that would be a little bit less maintenance as far as upkeep goes to have a generic product. But
okay, great. So we get this question a lot. A lot of gluten-free foods are not able to meet the whole grain requirement. And we get the question a lot about how that's reimbursed. And I was wondering if you could answer that.
yeah, so that would fall under where the accommodation does not meet meal pattern requirements. So you would need a medical statement, or it would need to be in the IEP or on the 504 plan. But for any accommodation like that, if it's not covered within the meal pattern, once you have that statement, then you can, it can either be paid for, the meal will be reimbursable if you have that statement. If you do not have the statement, then you could get those funds either through the IDEA or the general funds or something like that to cover that. It doesn't have to fall on food service.
Yeah, great. We get that all the time.
Yeah.
I think it's a confusing point. A lot of gluten-free substitutions, just because of the nature of the products, they can be a little bit higher in, some of the other nutrients like sugar or fat. Do you align your recipes to fit within the meal pattern requirements, despite the insertion of a product that might be a little bit higher in one of those things?
Yeah, and I would imagine, 10 calories can always, make a difference when you're entering that stuff in. But typically, I wouldn't imagine that you're going to have so many servings of that particular product that it's going to end up making like a huge difference in the average of a weekly meal pattern, because you're not looking at daily, averages there. You're looking at weekly. But I think to play it safe, that you should probably plan for that to still fall within the requirements. However, with that medical statement, I would think that would also cover you if that you were over, calories because you were using a gluten-free product that was higher in calories or higher in sugar. And there should point out that there are no sugar requirements in the meal pattern. So that's one thing you don't have to worry about. But if you're thinking along the lines of calories or sodium or something like that, it's probably best practice to go ahead and work that into your meal pattern. But if it is something that's make or breaking you with your weekly averages, then the medical statement, I would think, would cover that.
Yeah, and I know for a few of the recipes we provided, we worked with your team to kind of make them a little bit more nutritionally sound. So that was very helpful, at least for us. Yeah. Okay, we have another question. How much is InTeam training for an entire district, for a district of 6 schools, for example?
We actually do pricing based on number of users. So we'd have to get a little bit more specific, I think, about the number of users, but I would be happy to give you a quote if you send me an email with and we actually do it in like tiers. So it would possibly be, 150 to 300 staff or something like that. So just give me like a general idea of how many logins you would need for your district, and I can give you a quote.
Okay. So I think, Rachel has her email address here. So if you want to jot that down, she can definitely help you with the specifics on that. In my follow-up email, I will also include that so that you guys have it in case you didn't get to capture it here. Does the company offer help with transitioning to the software from what's currently being used?
Yes. Yeah. We walk through you with the onboarding process, and when we're available anytime after that too. You have like a dedicated person that helps you get onboarded, and you'll be talking to them a lot. So you'll be reaching out to them anytime you have questions, whether it's how come my menu is showing that I don't have milk on here or something like that. And it's just, you had maybe marked it wrong or something. So we work really closely with our clients. So yes, we definitely help you get switched over.
Yeah. Okay. So I don't see any other questions in here. Just so everyone knows, I have a lot of information about InTeam and the company on the Dr. Schär Institute website. So you can find pretty much all of the information, the introduction to the company, I guess, on the Dr. Schär Institute in a specific article, which I will also put in the follow-up email. So if there's nothing else, thank you, Rachel, for your time. Everyone, be on the lookout for a follow-up email from me, most likely this afternoon, and I will be announcing the winners. So if you get a second email from me, maybe you won. And thank you so much again. We really appreciate it. And I think this tool could be so helpful for schools who are maybe having a hard time managing students with food intolerances and food allergies. So this is really great. And thank you, everyone. I'm happy we had a really successful school nutrition webinar series this summer, and I'm hoping we can continue this next year. So thanks. All right, bye.
Thanks. Bye.